Hello everyone, welcome to the channel Basic Home First Aid. Today, we'll be talking about stroke, how to identify an individual who is having a stroke, and the first aid measures to perform. A stroke is a medical emergency that occurs when the blood supply to the brain is disrupted. Strokes are the third most common cause of death in the US, and many people live with long-term disability as a result of a stroke. Stroke is caused by any disruption to the brain that starves the affected part of the brain of oxygen and nutrients. This can cause temporary or permanent loss of function in that area of the brain. The majority of strokes are caused by a clot in a blood vessel that blocks the flow of blood to the brain. Some strokes are, however, as a result of a ruptured blood vessel that causes bleeding into the brain. Recognition of an individual having a stroke is done using the FAST guide, F for facial weakness, where the casualty is unable to smile evenly and the mouth or eye may be drooping. A for arm weakness, where the casualty is only able to raise one of his arms. S for speech problems, the casualty is unable to speak clearly or may not understand spoken word. T, which is time to call for emergency help if you suspect that the casualty has had a stroke. Other signs for recognition include sudden weakness or numbness of the face, arm, or leg on one or both sides of the body, sudden loss or blurring of vision in one or both eyes, sudden confusion, sudden severe headache with no apparent cause, dizziness, unsteadiness, or sudden fall. The aim is to arrange for urgent admission to the hospital by calling your country's emergency number and telling them you suspect a stroke. To reassure and comfort the casualty, check to see if they are breathing. If they are not breathing, perform CPR if you can. Cover the patient to reduce heat loss. Keep the casualty comfortable and supported. If the casualty is conscious, you can help him lie down on one side with their head slightly raised and supported in case they vomit. Regularly monitor and record vital signs, which include level of consciousness, breathing, pulse, while waiting for help to arrive. Do not give the casualty anything to eat or drink because it may be difficult for him to swallow. If you or someone else has stroke symptoms, do not take a wait-and-see approach. If symptoms are subtle or go away, take them seriously because it takes only minutes for brain cells to start dying. Thank you so much for sticking to the end of this video. Hope this gives you the common knowledge you need to identify and assist an individual at the onset of a stroke. Don't forget to like, share and subscribe so you always know when we upload a new video. Always remember, if not you, who?